My name is Kieran James. Today I'm going to be assessing the physiological responses to sporting injuries. Starting off with ligament sprains. Grade 1 is a slight tear of the ligament. This is where less than 10% of the ligament fibres are affected. Swelling is small here and hardly noticeable. Pain is also little. There is still a large range of movement at the ligament here, and this will only set the athlete out for 1 to 2 weeks. Moving on, grade 2 is a tear of the ligament. This is where 10 to 50% of the ligament fibres are affected. This can put the athlete out for up to 3 months. There is slightly more pain and swelling here, and it will be noticeable through a lot more bruising. Moving on to grade 3, this is a complete rupture of the ligament, and is where 50 to 100% of the ligament fibres are affected. This can be a season-ending injury and can put the athlete out for up to 12 months. There is a significant amount of pain here, and the swelling and bruising is very noticeable. Ligament sprains can be caused by a range of things, such as a slight change in movement, a slight shift in weight. For example, a basketball player may turn their body to receive a pass, whilst their foot is still planted facing the other way. This can cause a complete rupture of the ligament, which is a season-ending injury. Moving on, muscle strains. Grade 1. Grade 1 is a pull and is where less than 10% of the muscle fibres are affected. This isn't very painful at all and will only put the athlete out for up to 2 weeks. This is also hardly noticeable as there isn't much swelling or isn't much bruising of the muscle. Moving on, grade 2 is a tear of the muscle. This is where 10 to 50% of the muscle fibres are affected. This can be a lot more painful and be slightly more noticeable due to bruising and swelling of the area. This will put the athlete out for up to 3 months. Moving on to the third and final type of muscle strain. A rupture is where 50 to 100% of the muscle fibres are affected. This can be very painful and will be very noticeable as the injured area will appear bruised and red. Muscle strains can be caused by a numerous amount of ways. For example, the most common is when an athlete isn't warmed up and they go to perform their skill and exercise and then they tear a muscle. For example, in football, the player might not be warmed up and they might go out and they might kick the ball and then before you know it, they've ruptured their muscle. This is very common. Moving on, hematomas are very common also in sports. There are 2 different types of hematoma. The first being the intermuscular hematoma, which is shown at the top left, which is where the blood vessel is injured but does not spill outside of the vessel and stays within it. The second type is the intramuscular hematoma, which is where the blood vessel is damaged and then the blood spills out into surrounding tissue. This could be considered as the worst type of hematoma. Hematomas are generally defined as a collection of blood outside of the blood vessel. Hematomas are most commonly caused by the injuries to the wall of the vessel. For example, in football, a player might get an opposing player stud them in a specific part of their blood vessel, which can cause a hematoma. Hematomas are very noticeable and will be a build-up of blood. For example, in the pictures at the bottom, you can see someone's eye who's suffered an hematoma, which has gone all purple. To cure this, it goes through the blood clotting mechanism. For example, stage 1 is where platelets rush to the area to clot the blood. This is only a very short phase, however, because platelets can easily be washed away by the blood. Stage 2 is where clotting factors come into play. This is where they fill the gaps that the platelets has missed. Stage 3 is where the fibrin comes in, and which is acts as a glue and really sticks all together to clot the blood to prevent the blood loss. The final stage is all the other factors and usually takes place last, and is where the blood completely clots. Depending on how severe the hematoma is, the athlete will likely be out for 1 to 4 weeks. However, it is common that it can be a lot longer than this depending on how severe it is. Moving on to the stages of healing. The first stage of healing is the initial stage, which happens straight after the injury occurs. This is hemostasis. This is the body giving out. This is when the body goes into survival mode and prevents the loss of blood by creating blood clots. This stage begins within seconds of of the injury occurring, all the way until the body can survive without it happening. Moving on, the next stage is the inflammation stage. This will occur from 1 to 6 days of the injury happening. And depending on how severe the injury is will depend on how swollen the injured area becomes. This stage is also very painful, and is in fact one of the most painful stages of healing. Moving on to the proliferation stage. This is where this can happen from 4 to 21 days of the injury occurring. Pain will no longer be continuous here and will only occur when the injured area is being used or moved. This is where the bone or the injured area, in fact, will really start to heal and clear out all the unneeded parts to begin to heal. The final stage is the remodeling stage. This can in fact occur 3 weeks after the injury has happened to the athlete and can last up to 2 years. This is where ultimately the injured area fully tries to recover. For example, if it has a grade 3 muscle strain, then they would be trying to fully repair all them damaged muscle fibers to ultimately get back to fully functioning muscle so you can perform again. This is why this process is such a long process. And this can also be known as the maturation of the muscle. Going back to the hemostasis part, this is highly common in hematomas as there is a lot more blood spilling in this injury. Also, in the inflammation part, this is largely common in all types of injury as there is always going to be swelling to protect the injured area. The proliferation part is also common in all types of injuries as it needs to be in place to make way for the remodeling stage. Moving on to the final part, what affects recovery time of an injured athlete? The first being the cause of injury. The cause of injury can massively affect the recovery time as it can change the severity and grade of the injury. The second factor is the location and tissues involved. Depending on where the injury occurs can affect the recovery time. For example, if the injury occurs somewhere where there is a limited amount of blood flow, then this will increase the recovery time of the athlete. Moreover, the more types of tissue involved in an injury will further increase the recovery time as it will make the body work much harder and won't allow it to just focus on one type of tissue. Next is the grade of injury. This will affect recovery time as it will change the amount of fibres that need to be repaired. For example, grade 1 only requires a few fibres to be repaired, so therefore this will be much shorter than something like grade 3, where maybe all of the fibres need to be repaired. Moving on, the age and the general health of the patient and athlete will affect the recovery time. The younger the athlete, the faster they will recover. The healthier the athlete, the faster they will recover, as they will be likely to be consuming much better nutrition, which is what the body needs to recover. The final thing that can affect recovery time is the first aid recovery process of an athlete. Having a much better recovery process within the correct routines will also affect the recovery time. For example, an athlete who has specific members of staff and specific routines in place will recover much faster as their body will be getting what they need. That is all for the physiological factors affecting sporting injuries. Next, I'll be talking about the psychological factors affecting sporting injuries.